Hey there, my name's Abby, and I am 2 days post-op my second stapedectomy. So I thought during this healing time that it might be helpful to make a video for anybody who is contemplating getting a stapedectomy or already has one scheduled on the books and is curious about the procedure itself and the recovery and expectations. So probably first easiest to start off with why I had a stapedectomy in the first place, and kind of my journey with hearing loss and hearing impairment. I first had issues with my hearing that manifested as tinnitus right around the time when I was 41. I am almost 49, so about 8 years ago. And I went to the audiologist to further explore that, and they did an audiogram, and the results were pretty pathognomonic. So the way the audiogram flowed was consistent with a diagnosis of otosclerosis. And what that is a genetic condition where essentially the body lays down inappropriate bone around the attachment point of the stapes bone, which is one of the 3 tiny bones in our middle ear that have to vibrate and resonate to send information from sound waves, eventually to our auditory nerves so that our brain can understand and interpret those signals. So when that conduction, that ability of those sound waves to make their way to the brain are impeded by something wrong, so in this case, fixed, rigid bones that can't vibrate, that message doesn't get in, and it's called a conductive hearing disorder. Anywho, otosclerosis is thought to be genetic, and really what I found interesting is that women are overrepresented, and many of them are moms, people that have born kids, and I have 2 kiddos. So I think that put me in a kind of a higher risk for developing it. So at the time with that initial evaluation and diagnosis, I was referred to an excellent ENT, Dr. Torino, and she and her staff repeated the audiogram and also concurred with the diagnosis of otosclerosis. And at that time, based on its severity, I was offered either starting with hearing aids to see how that would improve my hearing, but also was offered the opportunity to consider having a stapedectomy at that time. And the stapedectomy is a surgical removal of the inappropriate bone and stapes, and the placement of a prosthetic stapes, essentially a piston that will be able to vibrate, a little bionic piston in the ear to replace that and return to some degree of functionality. And at the time when I was given that choice between hearing aids and the surgery, I opted for the hearing aids, in part because the post-op limitations of not being able to lift things and move around, any strenuous activity. I had actually, I'm a triathlete as just a side gig. I'm a veterinarian as a real job. But I had just qualified for world championships in triathlon. And if any of you guys out there are endurance athletes or athletes in general, the prospect of taking several weeks off of training is quite frightening. So that was one of the driving factors why I opted against surgery. And another one, frankly, were the limitations on scuba diving and skin diving in particular. I am a avid water sport person, a swimmer by trade, avid scuba diver, and that is something that is a really important activity for me. So that also made the surgery less interesting to me at that time. Anyways, so started off with hearing aids, and actually have had hearing aids now for 8 years. And was managing pretty well. Hearing loss is not an easy. All of you guys out there that are watching this probably experience it. I would imagine anybody considering a stapedectomy, I would have to think that otosclerosis is probably the main diagnosis, that prompts considering the surgery. So we all know what hearing impairment is like, and likewise, if any of you guys also suffer from tinnitus, I empathize. It's probably one of the hardest things I deal with in my life. So that challenge kind of added in, has been my journey for these past several years. And I was doing okay with hearing aids and everything. And then the pandemic came, and mask wearing came, and I'm pro mask, and I am pro vaccine, and I am clearly as a medical doctor myself, I believe in all these things, but having that limiter of not being able to read lips and engage facial expressions, I think prior to that, I didn't realize how much of my coping strategies not only involved having hearing aids to help me hear, but also, reading facial cues and reading lips. So when that was taken away from me, and still trying to perform my job, which is very much based on communication. Being a veterinarian is a lot of talking and interacting with people, and not having that ability to communicate as well, really put my level of hearing loss at the forefront of my thoughts. So anyways, that was a longer explanation than I planned, but here we are, and it is 2023. And finally, at the end of 2022, I realized that my hearing loss I had to do something more about it, because, I plan to live for another 49 more years, and living a whole nother lifetime with this level of hearing loss really wasn't palatable, really wasn't acceptable to me anymore. So I consulted with my surgeon again about approaching the stapedectomy as a solution, and we repeated audiogram. And for better or worse, in addition to otosclerosis, probably the other reason that my frustration with my hearing loss was worsening is that I now have a second level of hearing loss on top of the otosclerosis loss. I have sensory neural hearing loss in both ears as well. So otosclerosis tends to take away more of your bass tones, those lower tones, and then the sensory neural loss is kind of many of my higher tones. So anyways, I still thought that approaching surgery would be the best decision. So in February of this past year, I had my right ear done, and my right ear actually was my better hearing ear, but it is also the ear that I use more, and so I actually elected to have my initial stapedectomy done in my better ear, which is many times the opposite of what other folks do, but that's the route I went. And I am graced to have my excellent ENT and surgeon, who is also a scuba diver. She, I think everybody gets some degree of a fascial graft to help keep the little footprint of the footplate, of the prosthetic in. But I think she did an extra good job on it for me. I don't know. That's what I like to tell myself. But I had the first ear done, and I'll talk to you guys about that, and then also kind of give you my thoughts on what I just had done this past Tuesday. It's Thursday now, on my left ear, and why I chose to have that surgery. So we'll just talk about the surgery first, and kind of work backwards from there. So I had my my left ear, same procedure done just 2 days ago, and just to kind of walk you through the pre-op. It's a pretty standard pre-op procedure, SOP. So, the several days in advance, you're not supposed to be taking any NSAIDs, nonsteroidal anti-inflammatories, any kind of med like ibuprofen, etc., that might, sometimes we'll see some bleeding tendencies when those drugs are in your system as you head into surgery. So that's pretty standard for most surgeries to cut that out. And also any herbal supplements. So if you were taking any vitamins, etc., the preference is to just kind of flush those out of your system in the days before. Night before is NPO, nothing per os, which means, no food after probably midnight. I think I had my last something to eat around 9 p.m. the night before, and allowed clear liquids up to a designated point the following morning, just based on when your surgery is scheduled. It is outpatient, so you're not staying over in the hospital, but it is general anesthesia, so you are fully out, full general anesthesia, intubation, etc. Let's see, you will be asked often and many times to repeat all of your information, which is very wise. They want to make sure that you are the right person having the procedure done. They want to make sure it is the correct ear. In fact, you get a pretty awesome little indelible ink tattoo of your surgeon's initials on your earlobe to show that this is the correct ear that you're having the surgery done on. They will ask you if you have any allergies. I'm allergic to aspirin, so I had a special band that indicated that. You are taken kind of into a pre-op waiting room, your personal room, and the nurses take awesome care of you, just getting your vitals in the morning and placing your IV. So, you're going to have an IV catheter, intravenous catheter placed. And the purpose for that is a location where anesthetic drugs can go in. You're going to be attached to an IV fluid drip line for hydration purposes during surgery. So that's just easy venous access right there. What else? You meet with your anesthetist. You meet with your nurse anesthetist. My surgeon came in to talk to me before surgery. The head OR nurse came in to talk to me before surgery. So it was very, very comprehensive review beforehand, just to make sure everybody felt comfortable and all questions were answered. And then after all that, the person you came with, which for me was my wonderful husband, is excused to go to the lobby. You're not allowed to drive yourself home, so you have to have somebody there to take care of you. And then you kind of get an early pre-induction med, and then you're wheeled into the OR, and shortly thereafter you are asleep, and surgery is done. And surgery takes about an hour, and in that time, again, they're kind of harvesting a fascial graft if they need to do that. They are entering through the ear canal, removing that stapes bone, creating a little hole for the foot plate, taking out any of the diseased bone, and placing in that prosthetic stapes bone. And you wake up in the recovery room, and you are with nurses, and they are monitoring you. Whenever I have general anesthesia, it's always a little bit of a laugh. I have a very low resting heart rate. I typically hang out in the maybe mid to high 40s. And so I'm always setting off the alarms, and everybody's always getting worried and coming over and checking. And we all have conversations about bradycardia, and that is just my normal. So, but then the recovery is very smooth. You have, I think I mentioned it, but you've got packing in your ear, usually just a cotton ball. There is some expectation for a little bit of fluid and bleeding post-op. It's only natural. And the cotton ball is there to help catch that and absorb it. And then you head home. And some folks will have nausea or vertigo, kind of dizziness, vestibular signs post-op. It is surgery on your ear, so if any of you guys have ever experienced like a seasickness, that's probably a pretty good analogy for that, when you're haven't quite gotten your sea legs yet, and you're a little bit off balance. That's a pretty typical feeling. When it was my first ear, the kind of asymmetry and the change of level of sound was pretty profound, and especially because I hadn't for about 8 years heard any deep bass tones. That would be like the sound of a microwave or cars tires on the road or the flush of a toilet, those sounds were overwhelming, honestly. So be prepared for that, that if it is your first ear being done, that sometimes that advent of new sound can be pretty shocking. And it's a learning curve. It's an adjustment time phase where you're just gonna have to get used to that. It is not a surgery that is a painful surgery. So med-wise, I took 2 Tylenol the night after surgery, and I just preemptively took 2 more the following morning. Yeah, I've got some swelling and some tenderness, but gosh, compared to other surgeries, it is not a painful surgery. For me, the hardest pill to swallow is just the post-op limitations of exercise and movement. I often say that running and swimming and exercise are the duct tape that hold me together. It's really what helps keep me sane in life. So being kind of curtailed in activity is probably my biggest challenge. I get a little stir crazy, and it's my therapy, so my anxiety levels go up a little bit, but this too shall pass, right? This is all temporary, and it's all part of healing. And that's what we all need to expect after surgery, is there's no such thing as a quick fix. That is always true in life, and very much the case in this scenario. So backpedaling to my first ear, I think I mentioned that the first time around is harder because you don't really know what to expect. Other things that were unexpected, but part of the normal potential post-ops are a loss of taste sensation on the same side as surgery, and even loss of like your salivary glands don't make enough saliva. So I remember that very clearly on the first side, is that I was like very dry mouthed on the same side of surgery, and everything tasted like metal. And that's the case here in these kind of initial days on this side as well. Not so much the salivation, but everything kind of has a chewing on aluminum foil taste. Woohoo! It sounds fabulous, doesn't it? But I am cautiously optimistic that that this side taste sensation will stay pretty normal. I think probably the hardest part for me post-op the first ear is I was very hopeful that by correcting the underlying reason for my tinnitus, for my ringing in my ears, which is the hearing loss, I was hopeful that by correcting the hearing loss, the tinnitus would improve. That has not been the case for me. In fact, the tinnitus worsened, and it was also worsened, louder, and asymmetric. So different levels of constant ringing, different tones of constant ringing in both ears, which is, it's hard. It's hard. I could make a whole second video on, and probably a third, a fourth, a fifth, and a sixth on the challenges of tinnitus, and I won't. But I am really hoping that one of the things that prompted me having this second surgery is, like I said before, I just can't imagine living another lifetime with profound hearing loss. But I needed to see if even if I just get back to where I was before with the tinnitus, and the asymmetry is corrected and it's at least the same level in both sides, that'll be a win for me. If it's lessened, that will be best case scenario. So that's where we're at. So we are, I've had surgery on both sides and had the confidence enough in the first surgery to approach a second. The post-op limitations, I can swallow better this time around because I know that I can physically get back to where I want to be. I know that I've got the resilience to bounce back from it. So that's where we are. Yeah, I guess what I would say to anybody out there that is considering the procedure Don't be afraid of it. The surgery is the easy part. That's probably the best way to put it. The surgery is not, don't fear don't fear pain, don't fear anesthesia. You're going to be in wonderful hands. Your surgeons know what they're doing, and they're going to do a great job with you. It's just adjusting to new normals, which again is life, right? Like, we're always going to be thrown monkey wrenches in life, and it's just a constant lean forward into finding ways to adapt and adjust and try to make situations better. So thinking of all of you, thinking of you as you maybe do consider this surgery, or thinking of you as you are approaching the surgery. And I hope that you have a wonderful experience. I hope that things go very well. And also know that I know what it means to be in your shoes. And, you know, we're all out there doing this together. I think having invisible chronic conditions, things like hearing loss that nobody on the outside can see, tinnitus that nobody on the outside can appreciate what you're going through, it's hard. It's lonely. It's a lonely place to be. And I get that. And there are lots of us out there. And it's not just hearing loss, right? There's so many different types of chronic conditions that that people shoulder readily that are not visible to the outside world. So I see you, I feel for you, and I wish you the very, very best of luck. Take care on your journey.